Welcome back. I'm Dr. Margaret Ames, and you're listening to Your Dental Health. The mission of the show is to get the word out about biomimetic dentistry. Today we're joined by Dr. David Alleman. Dr. Alleman has thoroughly researched the scientific literature in the really well-respected journals, not the free ones that dentists get in the mail, but the ones that are thoroughly grounded by peer review. And he teaches a 6-day course on restoring teeth biomimetically. He had no support from any manufacturers from any products while doing this. So I had so much interest from listeners of last week's show about this that I invited Dr. David Alleman to join us. And Dave, welcome back.
Good to be back.
Okay. Now, we had talked a little bit about the difference in the patient's experience from traditional dentistry versus biomimetic dentistry. Can you talk a little bit about that, Dave?
I'd love to talk about that. The experience for the patient is just so much better, mainly because they don't have to go to the dentist as often. Many of these restorations that we've done are proving to be permanent. They're not failing, and so we don't have a need to return and get the same tooth treated every five years or every 10 years even. We're seeing these into 20 years success now, and they're not breaking down. And so a patient spends less time in the chair. It's more comfortable for the patient. The teeth do not become sensitive after treatment. The patients do not get toothaches because of the knee, because the nerves are dying in their teeth. So you're able to prevent retreatment, able to prevent dying teeth, able to prevent root canal treatment, less time in the chair. You save a lot of money over the lifetime of the tooth because you just fix it once and it stays fixed. So the value is just huge, and patients love that, not having to have root canals and crowns. You don't grind away the patient's tooth for this type of dentistry. It's just a win-win situation for the dentist and the patient.
Now, I had heard the number, this has the potential, I mean, our restorations are lasting a long time. You've been doing this technique for longer than I have, of course. But 30 years, 27 years, is that what we're talking about here?
Right now, 20 years is the longest restoration that we have been monitoring, and that's from Switzerland. But at 20 years, the tooth is still not breaking down, and so no treatment in sight. And my personal experience is over 15 years now. And so the retreatment rate for patients traditionally is 3% a year, where our retreatment percentage is 0.001% per year. And, of course, those are mathematical numbers that don't mean a lot to many people, but basically you have 1,000 times more chance of having to have your tooth reworked on if you do it with traditional techniques, but biomimetics makes your trips to the dentist almost come to zero after you have them treated.
Yeah, we both talked about those patients that you do a new crown, and then like a year or two later, the patient might have some symptoms. And we're both kind of horrified that after you do this great treatment, that the nerve could still die, even though it has the traditional cap or crown on it. So how does that differ from biomimetic dentistry?
Right. A recent study from from New York University Dental School showed that after 4 years, 20% of teeth with root canals were failing, for example. And so even having a root canal does not solve the problem. But the retreatment and the elimination of teeth that die is just unbelievable. We've had patients, our doctors we've trained, monitor their number of root canals in their practice, and the average decrease is around 40%, but many doctors have a 90% decrease in root canal treatment. If a tooth is already infected badly, then oftentimes a root canal will have to be done because the nerve is already dying. But if a tooth is vital and still has vitality in the tooth, then the elimination of root canals of 40 to 90% is just a great treatment benefit for the patient. And it saves a heck of a lot of money, too.
It's really exciting. That's why I want patients to come in to me before they have symptoms. People say, well, it doesn't hurt yet. Do I have to have a filling? Yeah. So what's your findings on
very,
that?
Very important. So, yeah, there's a great dentist in Texas named Tim Rainey who said early diagnosis and early treatment is the real key to saving tooth structure and eliminating root canals. And that's true. So early treatment is very important, is very, very important.
So now while your listeners, the kids are off from school, time to get them in, call my office. You're listening to Dr. Margaret Ames with Your Dental Health. We're talking with Dr. David Alleman, who founded the school, the Alleman Della Peri Center for Biomedical Dentistry. He's changing the world, one dentist at a time. It's fabulous. Dave, I noticed that some of my patients, I only see them now when they come into the hygienist. I miss them because they don't need any more dentistry. I mean,
yeah, you'll have to have a trip on a boat or maybe a trip to the golf course or a park. You'll have to have other social interactions with your patients now. I treated my sister-in-law 12 years ago. She was the first person I treated after my wife. I always, you treat your wife first, but I treated my wife 12 years ago and then her sister, and in 12 years she hasn't had any dentistry needed in 12 years now, so it happens quite often.
Oh, that's the best. Yeah. So one of the principles of biomimetic dentistry is that it values the life of the tooth structure over the life of the restoration. Can you elaborate on that?
Exactly.
I know you can, yeah.
Yes. So the way we've designed these restorations in engineering, it's called a fail-safe technique. And so, like in a car, you have certain things that can get crushed, but you don't want the passengers to be crushed. And so in the tooth, if you have a failure with the biomimetic restoration, you have a chip on the outside of the tooth. You don't have a crack that goes into the inside of the tooth, into the nerve, which will cause pain and death of the pulp and necessitate further treatment, root canal treatment. So these fail-safe mechanisms and the fiber placement in the restoration is one of the main ones, allows in a really high-stress situation because patients chew a lot and they're chewing harder foods because they're better for you, and a lot of times the harder foods can stress the tooth and the restoration. But if something fractures in 10 or 20 years, you would like a chip off the outside of it, and that's what's happened. I've had 2 restorations chip like that in the last 15 years, and those chips are repaired without anesthesia. You don't have to get a shot. It's just an easy bonding procedure on the outside of the tooth. You just add a little material to the outside of the tooth. So that's a great benefit of this type of dentistry, that it fails in a safe way.
I'll say. Now, I've only been doing it for 5 years, so I haven't even had any of those chips happen yet. But
no, they're very rare also. But a natural tooth is like that also. You can chip enamel off a natural tooth. It happens all the time, but it doesn't usually go into the inside of the tooth because of the way the tooth is constructed, and we mimic that. We try to copy that kind of tooth structure relationship. So the enamel will chip, but not the dentin.
Okay, one last question. We have a couple of minutes left. This person wrote in and she said, I was told by my dentist that I need a crown. Doesn't that mean I need a crown? What do you say about that? Yeah. That
means that dentist only knows how to crown teeth if part of the tooth is broken, and that's the way that traditional dentistry has been done. But I haven't done a crown on a tooth for over 15 years, and so it doesn't have to have a crown. You just have to have these adhesive techniques so that you can just replace the part of the tooth that is chipped off, or the part that is badly decayed, or that has a crack in it. All of those, you don't have to have a crown. I mean, obviously, most dentists, there's about 40 million crowns done a year by the 200,000 dentists in the United States and Canada. So it's still the standard of care. The dentists who I've trained, once they stop doing crowns, they don't go back to doing crowns because they see the advantage, and this is the kind of dentistry they want and their patients want.
Yeah, the endodontists and the dental labs think that we don't like them anymore because our patients aren't needing root canals or new crowns.
Yeah, they have to change theirs. Anyway, this is how progress is made.
Yeah, we're here for our patients.
we're here for our patients. That's right.
Well, Dr. Alleman, thank you so much for joining us today. I really appreciate your time.
Thanks for having me, Margaret.
I'm going to come back and sit in on one of your courses again because it's always exciting to see how on top of the science
you are. Hope to be in your show again. You be glad. Okay.
Great.
We'll talk to you soon.
Okay. Thanks, Dr. Alleman. Bye-bye now. If you've just tuned in, you're listening to Your Dental Health. I'm Dr. Margaret Ames. I can be reached at 631-261-4525. That's 631-261-4525. Or on my website at drames.drames.com. That's DRAMES at DRAMES.com. I welcome your input for future shows. Thank you for listening in. Enjoy your weekend. Hope you have a great day and get out there in the fresh air and enjoy the summer. Thank you. Talk to you next week. Bye-bye now.